Hi, everyone, and welcome back to Young Whisperer Show, live here on Instagram. I'm Dr. Aimee, and I love bringing you conversations with experts who can help you understand every angle of fertility health. And today I'm so excited to be joined by my friend and colleague, Dr. Katie Lee. Dr. Lee is going to talk to us about how oral health connects to your overall health and fertility, and she's passionate about helping people understand the power of the microbiome. She's going to help teach us how to make your oral health and your teeth sparkle. I got out of the car this morning. As I got out of the car, my husband says, make sure you sparkled today. I think he might be listening to my Instagrams now. Dr. Lee recently launched the Collective Health Society, which takes a really innovative approach to dental care and whole body wellness. And I can't wait for you to hear what she has to share today. She's been on the show before. I interviewed her for my podcast, and there was so much interest in the things that she talked about. And so I'm really excited to have her on. Hi, Katie. How are you today? Thanks for joining us. I really appreciate it. I just want to jump into one question real quick. And for people, because I know when people watch this and listen to you, they're going to be very interested in learning more. I just want to start off with, for people who want to work with you and learn more about their oral health and microbiome, where can people find you?
So I just opened up my new practice. It is called the Collective Health Society. So if they go to www.collectivehealthsociety.com, they can find me there.
Okay, great. Let's just start off and talk about the oral microbiome. We've heard about the gut microbiome, the vaginal microbiome, the uterine microbiome, and it's like, what? There's this oral microbiome? So why is it important for people to know about it who are trying to conceive?
Yeah, so the mouth is kind of a forgotten area of the body. You know, dentists took it out of the body a long time ago, and we're trying to put it back. So it's so critically important. So the oral microbiome is actually the second largest microbiome in the body, second to the gut. And everyone is really concerned about keeping their gut microbiome healthy, which they should be, because it's responsible for our neurotransmitters, you know, hormone production, metabolism, immunity. But what people don't realize is that the mouth is what's seeding the gut microbiome. So when you stop and think, how did the bacteria get there? Or what's affecting it? It's food, of course, yes, but also we're swallowing billions of bacteria a day. And what's not killed off in the small intestine and the stomach is getting into the gut. And then we're more concerned about what bacteria are getting into the bloodstream and taking up residence in the body from the mouth.
Yeah, I got to tell you, in baby making school, when I was a fellow, we weren't taught these things. So when you say fertility and oral health, I'm like, what? I think about the brain, I think about the uterus, but now it's another organ that we need to think about. So how exactly is oral health connected to fertility and reproductive health?
Yeah, so two different ways. One is there's certain bacteria themselves that directly affect fertility. So we know that there's certain bacteria in the mouth that make it difficult to ovulate, difficult for the embryo to implant, difficult to carry the pregnancy to full term, and linked to miscarriages and things like that. We know oral bacteria is tied to PCOS and endometriosis. We know that oral bacteria affects sperm and the ability to achieve erections in men. But then we also have the systemic inflammatory component. So a lot of people are chronically inflamed. And so the mouth is one of the major sources of chronic inflammation going on in the body, mostly because most people don't look in their mouth when they're trying to find inflammatory sources. So bacteria themselves and then chronic inflammation is how the mouth's connected.
I have the Tushy method, right? It's tubes, uterus, sperm, hormones, your genetics. I feel like I need to be, have you been tushied?
Yes.
And go see your dentist.
I love that. That'd be great.
And then what about the gums? I mean, we know about gum disease, gingivitis. I think a lot of people already know about how having gum disease can increase risk of things like preterm labor, preterm delivery. What should we know about gingivitis or gum disease when it comes to fertility?
So I just got goosebumps when you asked me that question, because for so long, even dentists were like, oh, you know, we're concerned about gum disease because that's where the bone is actually dying from around the teeth. But what we know from research is that it does not matter if you have gum disease or gingivitis. If you have these bacteria that are in your mouth that shouldn't be there and your gum tissue is breaking down, they're still getting into your system, regardless if you have the bone loss component or not. So we call it leaky gums. It's just like you can have leaky gut, you can have leaky gums. So throw out the gum disease versus gingivitis. If your gums are not healthy, your body's not healthy.
Okay. And then what about saliva testing? How is it done? What can you learn from it? And how can it give us insight about the microbiome?
Yeah, saliva testing is critical because without it, you have no idea what bacteria are in your mouth. So there's over 754 different types of bacteria. I should say 754 plus. bacteria in the mouth, and less than 1% cause any issues. But the problem is that depending on which ones are present determines what distant organs are being affected and then how to best treat them. Half of the bacteria in the mouth that cause issues don't respond to cleaning. So if you're only going in and getting your teeth cleaned, you're not doing anything for the bacteria, and they're constantly getting into your bloodstream. And I have patients that come to me from all over the country that say, I feel like something's going on. My dentist says that I'm totally healthy. And we look in their mouth and they look perfectly healthy. But then we do a microbiome test, we find all sorts of stuff that should not be there. So unless you test, you don't know, you're just guessing.
And then how do you test? How can we get started with that for someone who's listening right now and they're like, well, this sounds really interesting and I'm really interested in doing this. What's the first step?
Yeah, so you can order tests online. So Bristle Health does a saliva test that's direct to consumer. Viome does one as well. So you could take a test online and then take it into your dentist and see if they know how to read it. I will say, unfortunately, microbiome testing and result interpretation is not widely done in dentistry yet. We're getting better as a profession. Or you can order a saliva test through me and I can ship a kit to you. It's just a spit test. It's going to be the least painful thing that fertility patients go through. So a spit test, we get the results in about 5 days, and then we can go over the results together and figure out how to get people treated.
You don't have to take your pants off.
You don't have to get probed, no sticking, yeah.
If my microbiome is abnormal, should I care about my partners? I mean, obviously, if you still like your partner and you're kissing, there might be some exchange. Tell us about that.
I mean, I hope that people are trying to have a baby, right? That they like their partner and they're being intimate. So yes, we share and receive our microbiome from our environment. So when we're born, our mouths are essentially sterile. So everything that's in our mouths that we've gotten from our environment. And so it matters who you're with. And so I see people all the time where I have couples that are trying to conceive. We'll treat the woman, she gets better, but they still can't conceive. And then they eventually will bring the husband in, and it's the husband that's the source of all the bad pathogens. So we have to clean up both parties to get the best results. And plus, like I said, we don't want to treat one person, the other one still be infected, because they're just going to re-inoculate the original person that we treated. So important to test both.
And how long does treatment typically take?
Oh my gosh, it's quick. So the treatment in the office is typically 90 minutes. But then I'm a really big proponent of trying to set the patients up for long-term success. It's just like you can't go to the gym 3 times a year and expect a 6-pack, right? It's what you do day in and day out to be better. And so we set our patients up with a nutrition plan to eat for optimum oral health, and then a supplementation and oral hygiene plan, because they should be able to maintain this on their own once we get them balanced.
I see. And what kind of issues can change the microbiome? Are there any issues that can do that? Like what can be in the mouth that impacts the microbiome?
Yeah. So typically we see the big thing that's going to impact the microbiome is just bacteria that cause gingivitis or gum disease. So if someone is experiencing receding gums or bleeding gums, they typically will have a microbiome issue. Same with sensitive teeth. That's going to change the microbiome. And a big one that's really underlooked at is mouth breathing or apnea. So if someone is breathing through their mouth, they're drying out their tissues. They're reducing nitric oxide, reducing salivary pH, and that's just a prime environment for microbiome dysbiosis. So we screen all of our patients for airway in our office, but a big one's going to be diet, right? Like you are what you eat. Unfortunately, what our moms told us when we were young rings true. So if you're eating sugar and processed carbohydrates, that's what the bad bacteria in the mouth love. So what you're eating is going to affect your microbiome.
And then cavities, you shouldn't ignore cavities. Can cavities... No. I'm assuming that impacts your microbiome. They impact your microbiome too.
They do. When we think about cavities in pregnancy, a couple of things that we think about. One is, during pregnancy, cavities tend to progress really quickly. We also see, some minerals and nutrients leaching from the teeth because we got to grow another human. And so it makes the teeth a bit softer. Our saliva is also a bit more acidic during pregnancy. So cavities kind of start to grow and flourish. Plus, when you're pregnant, you have all the cravings and sometimes you're not feeling well, so you're vomiting. But if the cavities aren't treated, and a lot of people, 60% of pregnant women avoid the dentist when they're pregnant, cavities will spread to the nerve of the tooth. And now you have an infected blood vessel and nerve inside the tooth. And the teeth are organs. They're connected to the rest of our body's circulatory and nervous system. So it really impacts overall health that way.
And what are some simple daily things someone can do to support their oral microbiome and also protect their fertility?
Yeah. So simple stuff. So electric toothbrush, minimum twice a day, tongue scraping twice a day. Most important thing people can do is floss or water pick. So I don't care which one it is, not floss picks. Those are like the modern day toothpicks. So it has to be string floss or a water pick, and that has to be done twice a day. So our blood supply, or the connection between the mouth and the rest of the body, is through gum tissue, because that's where the blood supply is. So unless you're getting in between the teeth and cleaning the gums with floss or water pick, you're not touching the bad bacteria. So brushing is not enough. Flossing is way more important. So floss twice a day, brush twice a day, tongue scrape, make sure you're using chemical-free natural products. And then I love putting all my patients on 2 supplements. One is Protectin, which is an all-natural way to kill the bad pathogens in the mouth. It's good for the gut as well. And then I put everyone on a wellness oral probiotic to supplement the good bacteria.
And what you didn't mention was a mouthwash.
Yes. Yes. So mouthwash is not critically important for oral health. There's not a whole lot of research out there showing that it does anything besides temporarily freshen breath. So if you want to use mouthwash, go for it. Just make sure it's alcohol-free and chemical-free. Risewell has a really good mouthwash that I like. Their Breath has a good one, Tooth and Gum Tonic. You just want it to be all natural and gentle.
Got it. And for someone who's trying to conceive and wants to take action, what's one step that they can start with right away?
I honestly would just say take a saliva test. You don't know what's there until you do a test. They're readily available commercially. You can get them from me and some other biological dentists out there. But you must figure out what is in your mouth, because I think people would be surprised, especially men. Oral health and male fertility is a major, major connection. And then anyone that's suffering from endometriosis, oral health is big for that. There was a study that came out, I think it was 2023, that 64% of endometriosis lesions found in women had oral FN bacteria in them.
Wow. Every time you say FN bacteria, it makes...
I know, that FN bacteria. I should trademark that, the FN bacteria.
I think so. I'm just trying to see if anyone has any questions specific. I think there's one general question here about autoimmune diseases. Mm-hmm. Do you notice any difference between someone's microbiome, oral microbiome, who has an autoimmune condition versus someone who does not?
Yeah. So autoimmune and oral health, there's many ties with that, because when you have autoimmune and your immune system's totally activated, we got to make sure, number one, that there's no inflammation coming from the mouth, because anything happening in the mouth goes straight to the bloodstream through the gums and will cause an exacerbated response. So for those patients, it's even more critical that they see a provider to try and keep them healthy. I have my autoimmune patients come in about every 2 months instead of every 3. But then the other thing is, a lot of autoimmune patients have dry mouth from their autoimmune condition or their medication. Dry mouth exacerbates biofilm buildup on the teeth. So they are more prone to having more bacteria in their mouth than people without autoimmune conditions.
Let's see. Okay. Well, thank you, Katie, for joining us. I really appreciate it.
Thanks for having me on. I know dentistry is not everyone's favorite topic, so I appreciate the time.
When you said you got goosebumps over something related to dentistry, I'm like, that's how I feel when I talk about things related to fertility that just mean much to me. So it's fun for someone who's as passionate about what they do as what I do. So for folks who are joining now who didn't catch what we talked about in the beginning as far as where they can find you and how they can work with you, can you share that with us again?
Sure. So they can DM me at Katie Lee DDS on Instagram. And they can also go to, I have 2 websites, one for my practice, which is collectivehealthsociety.com, or they can go to my personal website, which is katieleedds.com.
Great. And so next week, we're going to do an Ask the Egg Whisperer just for people to ask questions about this to you. So, Katie, I look forward to seeing you again.
We'll see you soon. Thank you.
Thank you. Okay.
Bye.